Hello and welcome to the programme. Joining us in the studio is Olha Stefanyshyna, the Executive Director of Patients of Ukraine. Olga, thank you very much for joining us.
Hello.
So we have a lot to talk about. Obviously, just a few hours ago, the organisation that you head was raided by law enforcement officials. Firstly, can you give us a bit of background to this story? Why the organisation was raided?
It is sad to say, but in Ukraine we have a range of activities of security service, which are pressing anti-corruption organizations. And we have the law, as you know, which was approved in spring, which obliges all anti-corruption activists to declare their incomes, etc., etc. So afterwards, we had a range of pressure to Anti-Corruption Action Center, which is an active organization in Ukraine, and other active activists.
But is your organization linked to an anti-corruption NGO? Or
We fight against corruption in Ukraine for 6 years already in medical sphere. And one of the biggest achievements of our organization is that reform of procurement system of the Ministry of Health, because before the revolution, Ministry of Health procured drugs, vaccines and medical devices where 40% of funds were stolen by state officials.
It's incredible amount, 40%.
On the procurements. It's about $80 million per year,
wow,
which were actually overpaid by the ministry, and this pharmaceutical mafia was linked to state officials. After the revolution, we initiated legislation which let Ukraine go into international tenders using international organizations. And recently we had a report, an audit of this reform for 3 years, and our accountancy auditing service, which is a state service of Ukraine, discovered the economy savings of funds for state procurements, because they made a comparison of prices of the Ministry of Health in 2014 and now, and it's about 40%.
So these international sort of donors are essential, really, in monitoring the prices of medication to make sure they're not sort of overinflated by these certain people. Is that right?
Yes, we have outsourcing international organizations like UNICEF, UNDP, who do international tenders for the Ministry of Health and help them procure drugs and vaccines on the lower prices than it was earlier. And we, as initiators of this reform, are pressed by people who were involved in those schemes, corruption schemes.
And do those schemes
earlier
still exist, would you say? Like, how much have they decreased since these international donors have got involved?
They are absent now.
Completely? Yeah.
Yes.
Really?
Because,
yeah.
Yes, because international organizations make international tenders, so they don't use this local mafia.
Yeah.
And we compare the prices for the drugs, and we understand how much money were stolen earlier.
Yeah. So why do you think that these law enforcement officials are raiding your office then? Obviously, it sounds like you're doing very good work.
Our idea is that some people from law enforcement offices were involved in corruption, or some representatives of pharmaceutical mafia, so to say.
Yeah.
They just paid for us to be pressed by the...
But the law enforcement haven't actually given you any particular reason. Have they given like an official reason?
It's very funny, because we have accusations like we have stolen great amounts of money from the Global Fund, procuring drugs on high prices, but our organizations don't buy any drugs.
Yeah.
And this accusation is just insane. But we understand that, of course, they will not find some reasons for further development of this case. But what they have access to all our documents. They have a possibility to listen to our office, to our mobile phones, because they have this case, you know, official one, and they can do with us whatever they want. This is a pressure for our organization, and this is an attempt to block our work, because we had to prepare documents for 3 years for them, and this week all our office was blocked because we are just working.
Yeah, I've seen the photos on your Facebook page, actually, of accountants with sort of files of documents that they're going to hand over.
And she's very busy with that, and not with her work.
Yeah, and with this backdrop happening, the raids not just of your organisation but also of other organisations as well, how would you rate medical reform in general in Ukraine? Has it taken a step back, or
no,
is it still going forward?
We are very much supportive of this reform, and we have supported it starting from May, and we hoped it had been voted in summer. We had organized a lot of media events and actions to support this reform, because this is a crucial reform. And you should understand that Ukraine lived in Soviet era in a medical sphere for 25 years. Our country, having limited resources for medical sphere, spent this money on hospitals, on doctors, which were not used by patients. So we didn't pay for service. We paid for the existence of a hospital.
So we say in English, they were throwing money down the drain, which is what you said at a press conference.
Exactly, yes. And now we're happy to announce that this era is finished forever. And this is a crucial change. Of course, we have a lot of things to do, but this should have been done even earlier. Yeah,
and this word reform often gets thrown around by the government, by NGOs. I wanted to ask, for ordinary Ukrainians who don't necessarily live in Kiev, but in smaller towns and villages throughout the country, how do they actually benefit from this reform?
They will eventually receive medical services for free in Ukraine, because we have this constitution which says that everyone has medical service free of charge. But in reality, almost 100% of people paid out of pocket for this.
This is corruption, sort of bribes.
This is corruption, but Ukrainians even don't say that it's corruption. They just say thank you to the doctor, which doesn't receive a good salary. And the doctor which doesn't receive good salary doesn't treat patients well.
No, of course, it's the same for any industry, really. If you don't get paid enough, then you're less willing to do the job well.
70% of Ukrainians don't trust doctors.
How many? 70%?
70% of Ukrainians. They trust internet, they trust priests, and they trust their relatives. So they don't trust even to an ordinary doctor. And this new system, it will make doctors be interested in serving the patient, because their salary will be dependent on the number of patients they have, on the number of services they provide. Moreover, doctor will not be a slave anymore, because now doctor is a slave of the government. He or she is paid very small amount of money, and that is not allowed to do anything else. You know, now the doctor will have an opportunity to have his or her own practice, his or her own medical cabinet, and his salary will be dependent only on the quality of service he or she provides.
So the quality is improving then with this?
Yes, and the patients will feel this reform very soon, because doctors will be interested in providing high quality service to the patients, because they will be dependent on the patient.
And I have one final question for you as well. Obviously, within the past few days, days, we've seen significant decisions being made in the Verkhovna Rada about medical reform. Going forward, within the next coming months or years, what do you see the main obstacles to be, and what do you think the country can achieve with that medical reform?
Firstly, the law is not a final step. It's the first step.
But it's a big step, though.
It's a big step. Without the law, we cannot do anything. But after the law is signed by the president, we will have 2 months to develop all the regulatory basis and to create national agency. The Ministry of Health declares that they already have draft acts and papers to launch this agency, which is good, but it will take time to approve them, to discuss them with the society and to launch it. So I think that half a year will be spent on launching this system. After that, of course, patients should understand that they are now responsible for their health. They are now responsible for going to the right doctor and for registering, because now patients even don't go to the hospital, they just don't use services.
So it's more about raising public awareness as well in the future.
And this is the challenge for the Ministry of Health as well, to make this public campaign and make patients understand this.
Yeah. Okay, really interesting. Well, thank you so much for spending your time to come into the studio, and it's been great to talk to you.
Thank you.
Thank you very much. That was Olha Stefanyshyna. She is the Executive Director of Patients in Ukraine. You're watching UATV.